I'm John McCullagh from PositiveLight.com, and we're here today in the offices of the Ontario HIV Treatment Network with Sean Rourke, who's the organization's executive and scientific director. And Sean, you're a neuropsychologist, and you're internationally renowned for your work on brain health with people living with HIV. But what I'd like to talk to you today about is HIV-associated neurological disorder, otherwise known as HAND. So can we start by you just telling us what is HAND, in fact?
Sure. So cognitive problems with HIV have been around since the start. But recently there's a new term, like as you mentioned, HAND. And it's helpful because it actually gives us something more concrete to talk about. And within HAND, there are three things that can happen.
Mm-hmm.
So there is a dementia that can, a disorder, a condition where somebody has very significant cognitive impairments resulting from HIV, where and the level of those impairments impact on a person's day-to-day life in a very significant way. And so this is something that's very significant and severe. It doesn't happen very often. It's less common now than it was before, but it's one of those conditions. The other two, so there's two milder conditions. One that's called HIV-associated mild neurocognitive disorder, or MND. And it's one where there are milder cognitive impairments, but where those impairments are having an impact on a person's life, but in a more sort of mild or less severe way. And then there's a third condition where it's referred to as asymptomatic neuropsychological impairment, where a person has mild impairments in different areas of cognition, memory, concentration, like MND, but where there's no evidence yet that that's impacting on a person's ability to function in their day-to-day lives, doesn't impact their work or that sort of thing. So those are the three conditions that occur. The milder ones are much more common than dementia, but it's given us something now called HAND to talk about.
So it's good to hear that the HIV-related dementia is not as prevalent today as it was, of course, in the early days of the epidemic. But with HAND, is this something that we should be worried about as people living with HIV if the symptoms are quite mild?
I think so. And I think worry may be I think it's important to identify it if it's there, because I think the more that we can help identify it, the more we can help people manage it. And so I think that's a really important point. And I think it's something that a lot of my work is around the milder conditions of HAND, because I think they go unnoticed and undiagnosed. And I think people are suffering when they don't need to. And so a lot of my work is to try to better screen for these. And we still don't have the best instruments yet, but we're doing a lot of work around this area. Because these conditions do impact on a person's life. So if somebody's working, they notice that they have trouble more in managing things at work, or if they're not working, they may notice difficulties in different social situations. So it's something to identify, because then we can help people better manage those problems.
Right. So how do we know that it's not just aging? For example, I know I sometimes I'm at loss for a word, and I don't multitask as well now as I used to do when I was younger. How do we know that these kind of conditions are not just related to aging, but they are related, or even to HIV meds, maybe?
Right. Two important points. I think what we're learning about HIV in the brain is that it's a lot like accelerated aging. So that the problems. So everybody experiences. As they get older, you don't learn as fast, you don't multitask you don't run as fast as you did when you're 20. The brain changes, and I think what HIV can do to the brain is it can slow it down, or these problems with learning or attention or multitasking can show up earlier, and sometimes 10, 15 years earlier. And so that's why we sometimes think of this as accelerated aging, and they're a lot like aging. And so this is one reason why it makes it so difficult to screen for it, because it's part of what we see as people get older.
Right.
And so that's one of the things. Now, the medications may actually cause some problems. We just don't understand enough yet. For the most part, they're probably not doing a lot. But we don't know in the longer term, as people are living longer and people are on these, we do know that they affect all the organs of the body, and the brain probably is an organ that's is probably going to be susceptible to some of them, and we need to understand that better.
Right. So not every physician or healthcare provider, of course, understands the intricacies of either brain health and HIV together. So I know you have recently got some federal funds to develop a screening program to help physicians and other healthcare providers. So could you talk a little bit about the screening process so we understand how that might work? Like if I'm worried about these symptoms, who should I go to and what would I expect to hear from that professional?
Right. So, so as you mentioned, I'm a neuropsychologist. I work in a hospital, and we use a battery of tests that takes 3 to 4 hours to really do a good assessment of the brain. And my services are not available. I'm the only person in town doing this in Toronto,
right.
And there are very few people across the country doing this as well. And so the goal is to develop tools that help to identify these conditions and to help people then know when they should go talk to their doctors about them, and then have hopefully get access to more formal assessments to make sure, because a screening instrument isn't a diagnostic tool, and you really need the neuropsychological tests that we use. But it's a great way, I think, an approach to help identify people who may have these problems and then how to better manage them. So this study, funded by the Canadian Institutes for Health Research, is looking at 5 different tools and really evaluating how good they are at detecting the milder conditions. They're very good, we know, at detecting dementia, but as we talked about, that's easier to detect and for clinicians to pick up. And so these tools, I think, eventually will help us as we understand better how they perform, and as new ones come online, because we eventually like to have something that not only is available in clinics, but could be available online for people to do so that they can screen themselves. Right. I think this is, for me, this is the ultimate goal in terms of having more widespread availability of these tools so people can get in a sense of how they're doing and know when to talk to their doctors and seek help for those problems.
So in seeking help, what kind of tools are available to help us deal with HIV with hand?
So the first thing we know is certainly combination therapy is the most important to keep the virus at bay.
Right.
And so and we're learning too that probably earlier treatment is probably better. So there's a good rationale for people considering when to go on treatment, to consider that as another factor in the decision making that they make. But once people are on the medications, the combination therapy, there are other things that people can do. And I often say to patients when I meet with them that whatever is good for your heart is good for your brain. So think about the things that are good for your heart. So exercise, get lots of rest, watch your diet. If in terms of drinking alcohol, try not to drink too much. If you smoke, try not to smoke too much or stop smoking. These are all things that are good for your heart and good for your brain. So those are the sort of the general things, but I think what we're learning is that there's probably some other strategies that might be even better. And so we're now testing. We've just enrolled now 15 people in a study to look at brain fitness, essentially, physio for the brain. And we have some preliminary data and some results in the aging literature suggest that this is a really good strategy that actually might help people improve their concentration, their multitasking, and reduce their symptoms. So we won't know until we do the trial, but it offers some promise, I think, of another avenue besides medications. That's something active that people can do at home on their computers that may offer some benefit to the problems that people are experiencing with hand.
Right, so it does sound optimistic that there are things we can all do if we're experiencing hand that can alleviate the symptoms and allow us to live better with hand.
I think in the next few years we're going to find out that these kinds of approaches and even perhaps physical exercise are going to be really good strategies that we need to promote more in HIV for better brain health. Right. And I think there are things that obviously everybody can, or most people will be able to do, and have access to. So I think there's good promise, and I'm quite optimistic that we're going to find some other treatments that are going to be really helpful.
Excellent, that's good news, Sean. Now, I'd just like to finish by asking you to talk a little bit about the Centre for NeuroAIDS that you are hoping to set up eventually. Could you just tell us what that's about?
Yeah, so I've been working in this field now for over 15 years, and what I'm trying to do is to harness the expertise from across the country, across different disciplines in one place, so that we can actually tackle some of these remaining problems with hand. Things like treatments, things like understanding early therapy, things like trying to understand what exercise is going to be helpful, or what other mental health interventions can help. So it's really getting a group of people together that are multidisciplinary, that will really help to build a platform where we can build and test out different approaches and interventions that will hopefully prove to be helpful in managing hand.
Right.
And I'm involved with some collaborations around the world and some people that I train with in California, and so there's the other element to this is, I think, is the education and helping clinicians understand more about what hand is. I think in the medical field, there's a lot of ambiguity about what this is, and I think we want to build something that helps to educate providers. And then also for people living with HIV, I think there's a lot to be said about how we can educate, provide better information so that people can not be worried about it. Right. Because in most cases, it isn't something to be terribly concerned about on the one hand, but it's something that can be improved and probably better managed. And so we want to offer hope and opportunities for people to really identify this and help to better manage it.
Well, that's a very optimistic note to end on, Sean, because with living with HIV, we have to worry about so many things, and this is one more thing maybe to worry about. But from what you've told us, it's good. It's a good news story as well. There's lots of good coming out of it. So thank you very much for your time.
My pleasure, John.
Thank you.
Thank you.
And for the OHTN and PositiveLight.com, I'm John McCullagh.